Hello, everybody. It's Frances Reaves, your Medicaid and estate planning specialist from Parent Your Parents. I'm so happy to be here with you today. And my special guest is Shaun Corbett, the Chief Medical Officer of Miami Jewish Health. Hello, Shaun. How are you?
I'm very good, Frances. Thank you for having me.
Oh, it's always a pleasure. Shaun, you and I were together about 5 years ago, right? When you first started.
That's right.
As CMO at Miami Jewish. And you had told me at that time that, you really had some new and innovative ways in which you plan to bring rehabilitation to Miami Jewish. And voila! Here we are 5 years later with the Joseph Gringlas Integrated Rehabilitative Medicine Center. Woo, that's a mouthful. And I know it's your baby and your creation. So tell us, you had, planted the seed 5 years ago. So tell us about this new and innovative rehabilitative center.
Great. So I appreciate the kind words there. I have to be honest, it's not just my baby. So Dr. Agronin, who is our renowned geriatric psychiatrist, and he and I together discovered that there's a great need in the community for patients suffering both cognitive disorder as well as functional and physical disorders. So combining a lot of what he does and what I do clinically, we came up with this program, which we are now operating at Miami Jewish Health under the name of which you just stated.
Oh, I noticed you let me go through Joseph Gringlas Rehabilitative Center. Well, tell us a little about the innovation behind it.
Sure. So Joseph Gringlas was a grateful patient, and they had made a donation to our idea, which allowed us to do not only physical renovations to our space, which are cutting edge in terms of the equipment that we have now. It's a beautiful space. It's very healing in terms of the color schemes and what we're doing there.
I've been there. It is. Yes.
Excellent. And with that, when we looked at programmatic pieces to this, what we've done is we've added a care navigator. So as our folks age, and particularly those with cognitive issues, as we all know, navigating the healthcare system, which you know very well, can be an extreme challenge. So our care navigator is one piece to the puzzle that helps those folks navigate, not only within our organization, but even externally. So providing another layer of support to those families that are in need.
Now, is a care navigator like a person that's assigned to you and then sort of stays with you through both the cognitive and physical rehabilitative process?
Correct.
Now, are they usually a social worker, an MD, a resident, nurse practitioner?
So the care navigator can be anyone. We have a care navigator. She's not a social worker, but she's worked in similar capacities for other organizations. And the key to the what we look at our program is you get an evaluation usually by myself and or Dr. Agronin, of which we then determine what services you may need, whether that be physical therapy, occupational therapy, speech therapy, which also includes cognitive therapy. As well as neuromuscular massage therapy, even things such as acupuncture, for example. And we come together to determine each patient's individual needs. That care navigator then helps them walk through the steps in coordinating the appointments for those services within our organization. But even if somebody has an appointment outside of our organization, they can help coordinate that as well. So think of it as a concierge person at your staff.
Oh, I already like that. I'm going to put myself on the list so that when it happens to me, which reminds me, as far as being on the list, whenever you guys come up with a little thing that you implant in me so that if I fall, you can tell whether or not I'm sick or drunk. Remember, I want to be the first one on the list for that too.
You could be both.
It's so true. I hadn't thought of that. And so this sounds sort of like no one's been doing it. Now, I've known Mark Agronin for a while simply because of my husband, who has Alzheimer's, as we both know. But what brought you to it? Is that why you joined Miami Jewish? Was it just you and Mark over coffee, or?
So good question. It wasn't necessarily what brought me there. I know at Miami Jewish we have opportunity, which was something that's very interesting to me in terms of being able to be innovative, create new programs. But I think, one of the main differences of our program, there are piecemealed pieces of this in the community. You can find physical therapy in the community. You can find cognitive therapy in the community, but putting it all under one roof, particularly with someone I'm fortunate to work with, such as a Dr. Agronin. And prior to this, I ran our chronic pain program, which has a lot of the same components. And combining our services and really putting it under one roof is what is unique about this. And adding in the Care Navigator and then the beautiful space is something that makes this extremely interesting and innovative, where you can't find all of this under one roof elsewhere in the community.
Wow. And what about the country? Are you pretty much right up there in the beginning with the United States as a whole?
I'd like to think that we are. I don't know for a fact, but I don't know too many programs that rival ours. There may be somewhere, but I'm unaware of anything that's similar to ours. But I can't say with 100% fact that there's nothing.
Well, we need to check on that.
We will check on that.
Well, actually, Dr. Corbett has a fan club here. And ladies, if we could Google that, please, and come back at the end of the show. Well, it does sound, I do a lot, as you know, I do a lot of work. It's an elder law firm that I run along with Parent Your Parents. So, it does. And I started Parent Your Parents because there was no one place for elder people to go to get legal answers. Sure. And it sounds to me like you've done that on the medical side, because cognitive and physical go together hand in hand. And really, I'm just trying to think, we haven't really dealt with it that way. Certainly not in Miami, and certainly not in Baltimore, the two places I know.
Correct. And what we know here in Miami-Dade, which has the highest percentage of those 65 and over with a diagnosis of Alzheimer's disease. So we see more Alzheimer's disease here than any other county or city in the country at 16.6%. So to meet those needs, our motivation was in seeing these folks as they're mentally declining, we're also seeing a lot of the physical decline. So that's really what brought kind of this idea together. And I think this is the place, if it's going to start anywhere, this is where it needed to start.
Well, that's exciting. That really is exciting. Now, I have to let everyone know that I have a bias towards Miami Jewish Health. Six of my clients are there now, plus a husband. And Miami Jewish Health recently, my husband is actually has Alzheimer's and is in their Chernin skilled nursing facility, which recently received 5 stars for the Center for Medicaid Services, and only 10% of nursing homes in the state of Florida receive that. Is it the state of Florida, I would assume?
United States.
Oh, now we're national. Wow. I love that. Wow. Well, congratulations.
Thank you.
And that really is sort of your baby. The skilled nursing, the rehabilitation, am I wrong?
It's one of them.
I know.
I have my foot in a number of different pots at our organization, but the way that the organization is graded is based on the quality, and the way that's represented is by the star rating. So with only 10% of nursing homes around the country receiving that 5-star, this is something we've worked very hard for, and we're very proud of. Well,
and it's been it's been in the last 5 years. They certainly haven't received it prior to you were there. So, I don't know. I think I'd put a feather in my cap, but
I appreciate that, but it's a team effort.
I know.
Absolutely.
And listen, I know your team, and I can only say great things about them. I have a client on the 5th floor. I have a client on the 4th floor. I have a husband on the 3rd floor. And then I have a client on the 1st floor. So those nurse managers, the charge nurse on those floors really do make all the difference.
Yeah.
Go ahead.
They do. They know they work hard, and I think one of the greatest compliments is having a loved one there. Obviously, we wish medically didn't have to be, but nonetheless, having your loved one with us, is also a great compliment to us. So
well, I knew I could trust you. So it was an easy one to do. Let's talk a little bit about Dr. Agronin and the Frank C. and Lynn Scaduto Mind Institute, because that was the first institute that was started on the Miami Jewish Health Campus. And it's run by Mark Agronin, who is a psychiatrist with Alzheimer's specialty or elder law cognitive. He's an author of several books. I think my favorite is The End of Old Age. In fact, End of Old Age, Mark's book, reminds me a little of someone who I had dinner with the other night said to me, Francis, I really didn't know so much about all these issues for elders, and now I don't want to grow old. And I told him to read Mark's book. So talk a little bit about that. I know it's Mark's baby, but I know you have a lot to do with it.
Sure. So I think, Dr. Agronin's approach to aging, I think, is something that's also been innovative and refreshing, where we will all age. We will all, hopefully, right? Yeah. That's the nature of life.
I know.
But, his approach is looking at aging gracefully and how do we do that? And his focus over the major portion of his career has really been looking at cognitive impairment with a focus on Alzheimer's disease. This is a disease that affects a large percentage of, as I just mentioned, our population here in South Florida, and that's one that we're challenged with. So his approach has been looking at how do we keep our minds young and how do we prevent cognitive impairment, and when we have early cognitive impairment, how do we prevent it from progressing? So that approach has been really refreshing, and that's what's kind of given birth to the Mind Institute. Meaningful Minds is another program he runs through that, which is looking at early on stage cognitive impairment and exercise programs and mind programs in terms of keeping your mind young, and how do we, again, prevent progression to more severe disease.
And now, does the Joseph Gringlas Center also run the same type of studies? I mean, I know with Dr. Agronin, he's always got a study going on not just Alzheimer's, because there's several forms of dementia. I think Bruce Willis, for instance, has like frontal lobal. My mother had, I think, vascular. And Tom's at first you don't know, and then it becomes Alzheimer's. So under the rehabilitative medicine, do you all have sort of a studies pipeline as well?
So what we're looking at, and the interesting part of that, one of the things that we know that's best to prevent cognitive impairments, Alzheimer's, et cetera, is exercise. So through the Gringlas Center, providing exercise programs, we're able to help provide that type of exercise programs, and we're developing those. The science is still early, but we know that's one of the best things. Anything we can do to increase blood flow to the brain, we know is effective in helping to prevent cognitive impairment. So there's a partnership, and they dovetail together by providing those exercise programs and helping people, again, to hopefully avoid that cognitive decline. Through the research that Dr. Agronin's program, through Mind, they have 10 open trials currently that are all looking at various types of cognitive impairment with the main focus on Alzheimer's disease. If there's any current trial that's going on with Alzheimer's disease, they're running through Mind currently, and we're involved in all of those.
Oh, well, that's exciting. Okay, so let's talk a little bit about just Miami Jewish Health. Now, as I told you, I have six clients there, and it seems as though they've been around for about 85 years. It's a huge campus. It's a beautiful campus, but they kind of offer everything from, independent living, right, all the way to where my husband is, the Turning nursing home, I call it. And within that, and I think this is also pretty exciting, is your 2 PACE programs. And Broward just started. Why don't you, I love your PACE program, so why don't you tell us a little bit about that?
I think, one of the interesting things is we do operate the largest nursing home in the state of Florida.
Oh, I didn't know
that. We service about 4 to 5 times as many people in the community through our PACE program.
Wow.
So that we're very also excited about. So at our PACE program, the intention of PACE is to take those who are 55 and over, deemed nursing home eligible, live in our catchment area, which we have most counties in South Florida and have expanded into Broward, as you just mentioned. And then we're able to provide service to allow them to safely live in the community. And that's essentially what the purpose of PACE is to allow people to continue living in the place that they call home, whether that be home with family, whether that be home independently in their own home, or whether that be an assisted living facility. And the goal is for us to manage them both medically and socially to allow them to continue living a fruitful life in the community.
Oh, so in other words, what I think I just heard was that if for instance, you're in an assisted living facility and you're getting older and maybe even running out a little bit of money, you can be evaluated by PACE and stay in the same place where you've been, where you've already made these friends, you're doing all this stuff. And then PACE will pick up part of the Medicaid aspect of it. Now, I'm assuming just because I'm saying the word Medicaid, there's a qualification.
Correct.
There's a qualification to it. But you can live, for instance, if you're already at Miami Jewish and you've gone from independent to assisted living, you're not going to have to change your backyard. They're just going to pick that up. Now, will they also help a little with some of the money aspects of, like the rent for assisted living or?
So there is a stipend that can be, and it depends on each person's and their own financial position. And
right.
I would be remiss to say that I'm the expert in that prior process. They come to us typically through an enrollment team that evaluates, and again, the state has to first evaluate them and deem them nursing home eligible based on their comorbidities, et cetera. So there's a whole process that goes on before they actually come and get enrolled. It's typically a 60 to 90 day process to get someone enrolled in our program. But to your point, you can be living in your own home, apply for PACE, the state will evaluate you, our enrollment team would evaluate you, and you can stay living in your own home.
Well, actually, I am an expert on the Medicaid qualification. And I can tell you, because I've worked with PACE with several of my clients, they do provide a stipend, whether it's for assisted living or your own home, and it's really a way for Medicaid to save some of the money for the people who really need it, because you are in a place where you've already been. And I have to tell you a wonderful story, and this is a pro bono case of mine, and from Key Biscayne. And it was a husband and wife, and they're getting ready to lose their home. He was an architect and has very progressive Parkinson's, and she's been his caretaker. And so they brought me in, to help. What can we do? But she didn't want him, she still wanted him to be with her. And I put them together with Rebecca at your PACE program. Great. And I got the most beautiful letter from her about how, because PACE goes and picks them up and brings them home. And if you can just go pick them up and leave them there, then PACE will bring them home if something comes up. It has set this family free. The fact that PACE existed and they didn't know it. So I think we need more PR on that. I'm going to go to your marketing department.
I agree. And I think one of the beauties of the PACE program is that it's a social model and a medical model. So not only do we provide all of the medical services that somebody may need, it also serves as a daycare for elderly. So if somebody lives with their children who are working, and we call it the sandwich generation,
right?
Where they're raising children and taking care of an elder parent. We provide daycare services. There's services to come pick up. We've got, I think, over 35 to 40 buses that travel all around South Florida and pick families and PACE participants up, bring them to the center for the daytime, where then they receive activities as well. They receive physical therapy, occupational therapy as needed. Any type of activities during the daytime. Their meals are also covered. And then all of their medical services. We've got a medical director at each site with, on average, about 3 nurse practitioners. And our goal is essentially to keep people, number one, living in the community wherever they call home, which I think is extremely important. We know people want to age in place. And the other critical piece is that we want to do everything that's proactive and preventative to keep people out of the hospital. So if there's something that we can do that's unique, and if it's even seeing them from a medical perspective daily, and that's what this participant needs, we will do that. We don't have any limitations in terms of what we need to do or can't do from that perspective. So I think it's an extremely, extremely unique program, and I think it provides excellent service to the community.
And really, all it is, it's like it's a Medicaid Advantage program. And you go, now I'm assuming Broward has a different center than Miami does? Or do you bring the Broward people down to Miami Jewish?
Great question. So we've got 6 centers total.
Oh, okay.
One of them in Kendall, one in Westchester, one in Miami on our campus at Miami Jewish, one in Hialeah, one in Miramar, and then our newest one is in Fort Lauderdale, and that's the one that's in conjunction with Broward Health. So that's our separate program, but we have 6 different centers of where we service our participants.
And are you planning to go up to the next county with PACE, or you're going to sort of hang tight with Miami Broward and see what happens?
We are in a phase of growth. So we do.
Oh, that's great.
We do plan on expanding. For now, our expansion will be within Broward County, but we're always looking at other sites and areas where there's folks that need that type of service.
And, whenever I'm an old fundraiser from way back when, now I'm assuming that with both the Joseph Gringlas Center and the Frank C. and Lynn Scaduto, I want to say Lynn every time because the woman's so important, the Mind Institute. I'm assuming also that you do some outreach. I mean, I'm not asking the audience here for money today, but if you have some, don't write a check. But I'm assuming that you are out there trying to make these premier centers, right? And looking for partners and people to partner with in the community as well as you're serving it. I mean, PACE is totally a give back program. Correct.
Yeah, no, I mean, a lot of what we do can't be done without philanthropy. As you've just noted, the Scadutos were very philanthropic, so were the Gringlasses, which allowed us to create these innovative programs that help us meet the needs of our community. In addition to that, outside of philanthropy, we do have a number of partnerships. As I just mentioned, we're in partners with Broward Health to create a PACE program in Broward. We partner with other folks as well throughout our organization. We also have dialysis center on campus, which is in partnership with another company, as well as hospice services. So we partner with community providers. We work very closely with Mount Sinai as well, although it's no formal relationship, but we have a number of partnerships in the community as well as philanthropy.
And you do have an excellent hospice right there on the second floor Yes. No,
Yes, thank you.
several of my clients, the ones that are no longer there, did go through your hospice services. I sort of feel like I've done everything. I have one client who's in hospice now, and she started at your assisted living. So it's like, oh, look, I've actually been with Miami Jewish now long enough. I think it's been 6 or 7 years since your senior vice president found me on LinkedIn and said, "Oh, maybe we should meet." And we did, and ever since it's I'm a small partner, but nevertheless, it's been a partnership, and I'm proud to be a partner,
an important partner.
Well, first of all, I want to say that I think what you're doing, the fact that you're putting mind and body together, I mean, I've always felt like exercise, and you too, I mean, all you have to do is look at a person to know that they're out there doing the hard work, which is the exercise. And I never thought of it as simply as it just takes blood to the brain. Now, what else is going on in the brain rehabilitation? I mean, I know Billy Joel had what they call, I never get it right, normal pressure hydrocephalus, which is nothing more than water on the brain. Correct? And is that also something that you look for in the rehabilitative process?
So it's not something we necessarily would look for. It is something clinically we look for based on some of the symptomatology of what we see with normal pressure hydrocephalus. It's not a focus from a clinical perspective in terms of what we're treating.
Okay.
But it's something, if someone presents with those symptoms, we're looking for it. So from a rehab perspective, it kind of falls out of that, falls more on the purely medical side of things.
Okay. So in other words, as part of the Mind Institute, I'm assuming you see it through an MRI or a CT scan or one of those?
Correct. So typically we diagnose it, someone comes in with classic symptoms, and then usually they present to a hospital.
I see.
As many times what happens, or oftentimes to a neurologist, who then undergo a certain number of tests, could be CT scan, MRIs, et cetera, with the clinical picture, which then gives us a diagnosis.
Okay.
So that falls a little bit outside of the realm of what we're focusing on, although it is something we're aware of, and we have to know to recognize it to then refer it to the correct specialist.
to the correct specialist.
Correct.
And so I guess my question is, all of these though, like whether is Parkinson's also, I'm assuming you'd have to see Parkinson's in a rehabilitation area. And is the whole not talking thing, that's a Parkinson's thing, right? And is that something that your occupational group works on, or?
It is. So we do see a fair number of Parkinson's disease. There's a number of different things that you can do for folks with Parkinson's. So number one is typically medical treatment. There are a number of medications that we typically initiated, but as the disease progresses, we start seeing increased rehabilitation needs. So there's something called VST Loud, which essentially helps people pronounce and pronounce from their voice and enhance their vocal cords, because it is something we see is that the voice becomes weaker as Parkinson's progresses. So we do offer that through our speech language pathologist, and we offer therapy from a physical perspective as well as an occupational perspective. So we see a number of folks with, we call those movement disorders, and we do provide rehabilitation services to them.
Now, and I think last but not least, simply because of some of my clients and some of my experience. So Frances Reaves has someone that she feels that the Joseph Gringlas Center for Integrated Rehabilitative Services, that they need those services. How do I get there?
Great question. We have a number of different ways in which you can get there. You can call directly to our therapy center, which is one way to do that if you have a script from another physician. The other two ways that most commonly get there are from scheduling an appointment with me in my outpatient clinic, or scheduling an appointment through the Mind program and seeing Dr. Agronin. Those are the most common ways of which we then do an evaluation to determine what needs we think that individual may have and what services they may have. And then we provide the prescription, and that gets people into our program.
Oh, so it's a simple phone call.
Simple phone call.
Wow. And do we have a phone number for that?
We have a number of phone numbers for that.
Okay.
Which we can provide.
So if Frances were looking for this, she would call Miami Jewish Health, right? Mm-hmm. And then say, I need your rehabilitation services, or I need your cognitive dissonance service, or
correct. That's one way to do it. Another way is to go to the website. If you go to Miami Jewish Health website,
there it is. Okay.
And you'll see our website and all the phone numbers to get a visit with Dr. Grona, myself, or if you have a script to come directly in, the numbers are on the website.
That's great. Well, Dr. Corbett, I can't thank you enough for coming in today, for talking about one of my favorite places in Miami, and honestly, for all that you do, for Miami and now Broward counties through the PACE program. A lot of my clients have used it, and I know that I personally have been thanked for it. So thank you.
Thank you for having me, and thank you for your continued partnership, and thanks for having me here today.
My pleasure.